Joyce Gibb, and I'd like to thank you for being with me today. Today I have a topic that I really feel like is being misunderstood in the general population. And I recently heard a talk by a Dr. Abraham Morgentaler. He is a Harvard-trained researcher, and he has the Boston Men's Clinic. So it was really an interesting talk because I know as a nurse practitioner, when I was being trained, I was told, do not give men testosterone that have prostate cancer, or if their PSA is elevated, that will cause them to have worse prostate cancer or to make them have prostate cancer. And all that's been refuted by Dr. Morgentaler. And he started out in 1996. You know, he was trained in that philosophy and that theory. And in 1996, he decided that let's kind of prove it. He had some men, 77 men in this study in 1996 that he published this. And he decided, okay, men wanted to have some testosterone supplementation. They had symptoms, which may be, decreased libido, which is not right for men, decreased erections, poor mood, depressed, unable to have, maintain muscle mass, not able to work out as efficiently, your muscles just feel tired. They had symptoms. So he talked with these patients, 77 patients, and they actually agreed to have prostate biopsies. They had normal PSAs, they had no history of prostate cancer, and they had, no symptoms of prostate cancer. So they agreed to have a biopsy done. And to his surprise, they were all, 14 to 15%, or 11 of the 77 patients actually had prostate cancer. When he was taught, and I was taught, that, even normal PSA, you don't have symptoms, your digital rectal exam's negative, you're less likely to have prostate cancer. But he was really surprised to see that 11 of the 17, or of 77, which is 15%, had prostate cancer. So it made him think. He's thinking, okay, if they had low testosterone and they needed treatment. So if low testosterone really is not protective against prostate cancer, could potentially testosterone supplementation be protective against prostate cancer? There was study after study that does show this, and over 20 years it shows that prostate cancer testosterone supplementation is protective against prostate cancer, heart attack, strokes, and even death. But then that was in question. In 2013, there was an author, and they did a study, and it wasn't a random and controlled trial. And random controlled trials are you give one group the control, whatever it is you're testing, the other group you don't give it to them, and then over time you see what happens. But the study that was published in JAMA in November of 2013, Journal of the American Medical Association, which is a very prestigious journal. The author his last name was Vigen, I think Vigen, V-I-G-E-N. And they found that testosterone supplementation was associated with increased risk of heart attack, strokes, and even death. So Dr. Morgentaler and his colleagues, they were all looking at the results of this study. It was on the news, it was everywhere, it was published everywhere. Testosterone does cause problems. Well, they were looking at the numbers and they saw that the numbers didn't add up. The amount of patients in each part of the study and the patients that had heart attacks, strokes, and death was reported that testosterone made that worse. But actually, the study was the opposite. The results were the exact opposite. So he and his colleagues, he decided to contact the editorial board of JAMA, explain this numbers. The editor actually says, wow, we need to take a look at this. About a week later, that report was refuted or was changed. The report was changed. And, of course, that didn't make the headlines. And the report showed that actually testosterone supplementation is protective against prostate cancer, heart disease, strokes, and death. So they did, about a month later, they also published another addendum to that. There were actually women in this study, and that wasn't reported in the first time anyway. So when you look at testosterone, I actually had somebody today where her husband was getting testosterone supplementation, potentially getting that. He was just on DHEA. DHEA is a hormone that downregulates and makes testosterone. Well, the endocrinologist that they were going to, they were afraid that he was going to get some kind of testosterone cancer if he was given DHEA. And so I explained this to his wife, what Dr. Morgenthaler's study was, and it's just, nothing against the physicians, but it's hard to keep up with all the research. And, he actually, Dr. Morgenthaler is one of the foremost researchers in this subject. So, and I actually had a patient that had dementia, and that's the other thing, low testosterone causes dementia in men. And so that's another reason they get foggy brain, their memory starts declining, so it's another reason for testosterone supplementation. So you just look at everything, you try to look at the study and look to see what's refuted. And the one thing that's kind of that we think about, what happens when cell phones are in men's pockets? That's close to your testicles. And he talked about there's a 50-50 chance that, you wear on one side or the other, whatever your cell phone is, that you may actually potentially have issues with prostate cancer because, or ovarian, or not, or testicular cancer specifically because of, more specifically, testicular cancer. And there, men that have an undescended testicle have a 4 to 10 times risk of having testicular cancer. But you just have to be careful. There's a lot of rays emitted, from the cell phone. It's a lot higher than it would be just watching the TV, etc. So, and that's really close to the testicles. So just be careful, men, where you hold your cell phones. So if you would like to talk to me about this and your risks, I would be glad to go, work with you about a holistic approach as to how we can get your testosterone up, how we can do that naturally. And of course, men that are depressed, they have low testosterone. It's been proven men that take narcotics routinely have low testosterone. Men that have adrenal depletion have low testosterone. So there's many other reasons why you have low testosterone other than aging. So I would love to help you on your journey to good health. Just give me a call and we'll talk about this in depth. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.